apologies if you can hear the crappy music in the background. Can't help that because of the settings I'm in. Rest in peace, daytime recording. But anyways, probably shouldn't make jokes about that actually. So we've got this reporting here from Kieran Jenkins, I hope that's how you pronounce his name, revealed local authority calls on care home providers to accept COVID positive patients. So what we can see from this is the contract from Trafford Council to Greater Manchester in Greater Manchester outlines how eligible care homes will receive COVID positive patients within just 2 hours of the patient being identified by the hospitals ready for discharge. So what that means is once they've partially recovered from the illness, say they caught it within a week, they feel fine. But obviously we know that the virus incubation is around 2 weeks, so it can stay in your system for around 2 weeks. And you're meant to, I think the current guidance is you're meant to self-isolate for 2 weeks after you stop showing symptoms. And what we can gather from this is that as soon as they're ready to be discharged, they have to be discharged. And so it sets out terms for rapid discharge of patients from hospitals and states that some of these patients may have COVID-19 symptoms, whether asymptomatic or symptomatic. And the problem here is that what the government is fearing is obviously the problem we had before with bed blocking, which is essentially people who were older people in hospitals who possibly had whatever illness is, coronavirus in this case. As soon as they're ready for discharge, they have to go because the healthcare system is not fit for purpose. Basically, it's not fit for purpose, and there's not enough space in hospitals for patients. So what that means is it's a one in, one out kind of thing. So you have to force people out before you can let them into hospitals. And so by forcing these people out back into care homes where they can infect other people and essentially potentially kill them, that's where the problem comes from. And so the hospitals don't have capacity to process people, so you have to kick people out. That's basically the rules of the game. It also sets out terms for rapid discharge of patients from hospitals and states that some of these patients may have COVID-19 symptomatic or asymptomatic. A leading clinician warns that this could become commonplace for hospitals carrying COVID-19 patients to be discharged into care homes in England this winter, despite the controversy it caused in the early months of the pandemic. And the NHS struggles every winter with seasonal flu and all that stuff. So you throw in a virus into the mix, and what have you got? A horrible situation. So Professor Adam Gordon told Channel 4 News that discharging patients from hospitals to care homes was accelerated and escalated in the early months of the pandemic, and that could happen again in line with the latest government guidance. So basically he's saying that the government guidance will allow COVID positive patients to be discharged from hospitals, I guess unless they're at the threat of dying themselves. UK government guidance updated on September 16th reiterates that care homes in England should be prepared to accept COVID positive patients from hospitals. And so we don't actually know what kind of preparation care homes are going to have. And that's a key issue here. As part of the national effort, the care sector also plays a vital role in accepting patients as they're discharged from hospital, because recuperation is better in a non-acute setting. So I guess that means that patients can recover better, obviously, like when they're not at threat of dying in a care home setting rather than in a hospital setting. Some of these patients may have COVID-19. The guidance also states that homes will not be forced to admit COVID-19 positive patients. So basically some care homes will try and reject these people, but not all of them will be able to because of either financial reasons or probably financial reasons, to be honest, or whatever the rules are for care homes. In Scotland, patients should test negative twice before being discharged from hospital to care homes. I mean, like Scotland that's a good policy. That's a good policy right there, because you can get false negatives and false positives. So that's a good rule right there. That will stop the spread inside care homes. But obviously, the English government doesn't really care about that. Earlier in the pandemic, tests were not required before discharging patients into care homes. The latest data from the ONS is that there were 15,501 COVID-19 related deaths in care homes in England and Wales up to the 4th of September. And that's one of the reasons why New York also has a very high death rate, is because Andrew Cuomo basically pushed care homes to take back COVID positive patients, and that spread the virus quicker in these places, which you already have incredibly vulnerable people who get sick very easily because they're old. And what do you expect is going to happen? They are aiming for patients to be taken out of hospital into care homes within a few hours of the decision to discharge them. That process used to take about a week. I mean, a week's probably too quick during the pandemic, but what they're doing is they're trying to stop the hospitals becoming overloaded. And the only way to do that is you kick people out, because you don't have the capacity to deal with everyone. if you have people taking up beds, that's one less bed for someone else, to put it bluntly. And it's not a good system. I mean, the healthcare system, they wanted a lean healthcare system, but they cut into it way too much. And this is where you get problems. It was already suffering. It was a system that was already not fit for purpose. During a non, before any pandemics hit, that have higher fatality rates than the flu. And what happens now when the system doesn't work properly? It's not built for this. You get massive problems with the healthcare service. It says here, we have contracted local authorities for block beds, and you have to have a very good reason for rejecting referrals. So if anyone's referred to a care home, then the care home, if they say that, well, we can't take COVID positive people, they'd be like, well, the guidance is you can, so you have to. There is an expectation and a pressure to accept all patients. The insider said current problems with testing in the UK meant care homes could not know whether the virus was circulating in the home after accepting COVID positive patients. When you're bringing COVID positive patients into a care home, many will die. We have strong procedures to prevent the spread, but this virus is extremely contagious, so they are meant to test care home staff once a week. But within that week it could spread really quickly. We are relying on the testing system to keep our residents and staff safe. The testing system now, which is essentially failing. We have staff and vulnerable residents who are being put in danger. Care homes may not be safeguarded, and no one in government seems to care. I mean, I'm not surprised, to be fair, because in the government side, these people, even though some of them vote Tory, a lot of them may vote Tory, these people are a burden to society now. They've lived their lives. They've worked, they put into the system. Now the system is meant to give back to them. What happens? The government don't care. And that's the top and bottom of it. I don't care what anyone else says. You put what you want in the comments. Professor Adam Gordon of the British Geriatric Society has been running a red zone COVID ward in a hospital during the pandemic, and says infection control precaution taken in hospital present a challenge for care homes to replicate. And so, running, essentially you're going to have some sort of space where you can put the COVID positive patients, but the care home staff need to be given, top of the line gear, talking N95 masks or FFP2 masks, and goggles and all that stuff, because if they contract it from one of the people that were discharged into the care home, then you're asking for a recipe disaster, because they'll spread it really quickly, and it won't be their fault. It'll be the fault of the guidance which allows COVID positive patients to go back into hospital. Professor Gordon said it can be very difficult to isolate people with COVID safely, and it's really quite significant burden to place on care homes to take the responsibility when they perhaps haven't been able to see the patient and aren't quite sure what their care needs will be at the point of discharge. Care homes are not hospitals. They are designed to be homes, and in many instances care home staff are not healthcare professionals who in the past have had a really in-depth training in infection control. If you were to be absolutely belt and braces about this, I don't know what that means, you might choose to isolate patients in the NHS setting until such time that they were confirmed to be COVID negative. That's what they're going to do in Scotland. And I think that would be the best thing to do if you create more COVID wards, more stuff like the NHS Nightingale hospitals. But the problem is we don't have the staff to operate these sort of hospitals because the healthcare service has been incredibly cut. Nurses' bursaries, I think it's only been reinstated recently, and it's just a really bad way to run a system. I reckon in government, if you got rid of so many members of the civil service, the government would fail to function, because that's the nature of not having enough people to deal with, certain job roles. That's how it is. And, if you told a minister, we're going to get rid of, the majority of your advisors and the majority of your civil servants, you're going to have to do a lot more legwork on your own. They're going to go mad. And that's essentially what's happened to the healthcare system. You already had a system where there were massive shortages of nurses already, shifts where I think there were at least 2 nurses short from the jump. They were, 1 or 2 nurses short per shift. And now, if you take them out and put them into Nightingale hospitals, that hospital that had their staff taken away from them has even less. Embarrassing stuff. The last time we saw the hospital system under pressure, and part of the response was to try and accelerate and escalate discharge into care homes. That's what they did last time, and that's where a lot of the problems came from. If we see similar pressures on the hospital sector this time around, then they will be commonplace under the current guidance that people who are COVID positive will be discharged back into care homes. I think is right there. A spokesperson for Trafford Council said the discharge of patients from hospital is carefully coordinated process in line with national guidance, but the thing is the guidance isn't good enough. That's the problem. You can say, we're following the law here. We're following the guidance, but if the guidance is bad, then the rules are wrong. You can say you're following the guidance, but the guidance is wrong here. At all times, the health and well-being of a person being discharged is our primary concern. If they're discharged to a care home, we make sure it is one that meets the needs of their health and social care needs. What about the other people in the care home who didn't contract COVID and now are going to contract it because you discharged a COVID positive patient into a care home. What about them? We appreciate that there is a quick turnaround, but our contracts reflect the national requirement to ensure people are discharged safely and quickly. The alternative to doing this would be to leave the person in hospital. This would mean that the person's recovery may take longer in an inappropriate setting, leaving them at high risk of infection, while also preventing seriously ill people being admitted to hospital to receive the critical care when they need it. And this is the problem here: is you're taking a person who's on the mend, but is still infectious, in order to get in people who are suffering. And what that means is you're going to create a system where that one person who gets discharged is going to go on to infect one or two other people, and then you create a massive spiral of chaos, essentially, where you're going to get massive amounts of infections inside care homes. And by discharging one person into a care home, if they're not isolated properly, then that whole care home can become infected. And then all those people, if say 3 or 4 of those people need treatment within a week, then you've got more people who need to go to the hospital. And that's one of the key problems here. It is also in the contract that care homes have the right to refuse to accept a patient, and no patient is transferred to a care home without a discussion arrangement of the care home. It would be totally against our values simply to turn up to a care home without the care home's prior agreement. It would also be against the interest of both the care home and the person, but we already know that the care homes need a good reason to refuse a patient. So it's also important to note that we insisted from the start of the pandemic that any patients ready for discharge were tested for coronavirus beforehand to reduce the risk of infection within the community. So, but even if they're tested, at least the care home knows that they're COVID positive. But at the same time, if they don't have the facilities to isolate the person, it doesn't do a massive amount of good. Apart from it alerts the care home staff that they have to make sure they have the right protections around working around COVID positive people. The care homes in Trafford, which provide the rapid discharge to assess service, have been extremely supportive throughout this pandemic, and we are very proud to be working alongside them. And the Department of Health and Social Care sent us a statement in response saying our priority is to ensure people that are discharged safely from hospitals to the most appropriate place, and that they continue to receive the care and support they need. But what about the other people who are going to need support because they may catch COVID from this first person? What about them? That's that's one of the main problems here. And it goes on: no care homes will be forced to admit an existing or new resident to the care home if they do not provide appropriate care. And so what we can see from this is that there is pressure. There is pressure to take people on, and that they are aiming for patients to be discharged out of hospital into care home within hours of the decision of discharging them. That process used to take a week. This is stuff we've mentioned before, but we know that there was pressure in the past. And there is still pressure for care homes to take COVID positive people, and that's that's a main problem here. And I think that'll wrap this segment up. That the fact that the government still haven't learned their lesson, and you can say that in part they don't have a choice here, but they had a choice a decade ago when they chose to make cuts, deep, horrible cuts in the NHS, which left the healthcare service that didn't function properly in non-pandemic years. So what happens when the healthcare system is even more strained? It doesn't take a genius to figure it out. If you drain something of too much blood or whatever, it starts failing. It's not the NHS's fault that this has happened. You can say that there are areas where they waste money, whatever. It doesn't amount to the amount of budget cuts that they've suffered. And what that means is the NHS is still going to struggle, especially in the next, this year. This year could break a lot of healthcare workers, a lot of doctors, surgeons, GPs, or whoever has care home workers, whoever deals with the major problem within the NHS this year. This will do a lot of mental health, a lot of damage to their mental health. And that's sad, that's upsetting. But I'm going to wrap up there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.